and welcome. Today we are going to discuss about what are para-athletes, what are Paralympics and what are the different sports classes and categories. So before going that, we will understand what does the Paralympic term means. We will divide it into para as well as Olympics. Now para is a Greek word meaning parallel to or along with. So the games which happen parallel to the Olympic Games are known as Paralympics, and the athletes who participate in these games are known as para-athletes. There is a special consideration of these athletes that these are the athletes or the sports persons with some or the other disabilities. Now, what are those disabilities and what are the categories and all that we will discuss at a later part of our video. The first Paralympic Games happened in Rome, Italy, post-World War II in the year of 1960. And these games were purposely or majorly introduced in order to help or assist the veterans or the civilians who were injured during the wartime. Discuss the different sports categories and sports classes which are defined by International Paralympic Committee, which is the main body which looks after the Paralympic movement. The main purpose of these sports classes or categories was to decrease the impact of disabilities of these athletes on their sports performances, and thus a strict rules and regulations are made for the eligibility criteria, and all these athletes compete with their co-athletes with the same disability. So let's go to the first category, that is impaired muscle power. Now what does that mean? Impaired muscle power means it is those athletes are categorized under this heading which are not able to generate maximum force by their muscles, or they are not able to voluntarily contract their muscles optimally. This condition usually happens because of spinal cord injury or post-polio syndrome, etc. Next category is impaired passive range of motion. A range of motion is divided into active range of motion and passive. Active range of motion is when I am able to bend my elbow joint voluntarily. If I need assistance or a partner support for bending it, that is going to be a passive range of motion. Now, when we talk about active range of motion, it is because of multiple reasons, and it is usually temporary. Because of the physical therapy and rehabilitation treatment, this range of motion can be regained. But when it comes down that the range of motion is decreased, that's the passive range of motion is decreased, it is usually because of some chronic condition like contractures or severe muscle or bone injury. Next category is the limb deficiency, that is the partial or a complete loss of the limb, that is upper extremity or lower extremity. Now this can happen because of any severe trauma to the upper extremity or lower extremity which has resulted into the amputation of that particular part. Next, it can be because of some chronic disease like bone cancer, or it can be because of some congenital absence of the extremity. Next category is leg length difference. Now what does this mean? If both the lower extremities are not of equal length, there is a difference which is more than the standard value. Such athletes will be categorized under this heading of leg length difference. Now this can again be because of some growth problems or because of some hindrance or obstruction in the limb growth, or again because of any trauma. Next category is our short stature, that means reduced length of the upper extremity and lower extremity and trunk. So these things you mainly happen because of the growth hormone dysfunction or because of the multiple conditions. Let's move to another category, which are the neurological categories like hypertonia, athetosis and ataxia. Hypertonia means increased tone in your muscles. Now we all have some normal tone in our muscles. That's the reason our movements are smooth and most of the time, and that's the reason our movements are very smooth. If the tone of my biceps muscle or triceps muscle is going to increase, or any other muscle, my movement is going to get restricted and it's going to be more and more difficult. Such athletes are going to face challenges in their range of motion, in their coordination skills, etc. Next condition is athetosis. Athetosis means there is incoordination between the right side and the left side of the body. So most of the times we usually test this by the finger to finger test, where we ask them to touch the right side, right hand finger to the left hand finger and take it back. This is a test which is going to be very challenging for the athletes. Whose tests are going to be challenging for the athletes facing athetosis. Next category is the ataxia. Ataxia means there are continuous, slow, involuntary movements going on in their body, and these athletes are not able to maintain a steady state of their body, which results into loss of balance, incoordination, gait issues and many more. So all these three, that is hypertonia, athetosis and ataxia, do occur because of some serious injury to the central nervous system. Then it can happen in the cerebral palsy children, it can happen in spina bifida and multiple sclerosis as well. Next category is the visual impairment. That means there is partial or complete loss of the vision, but because of some structural damage like an injury to the visual cortex of the brain, or it can be an injury to the optic nerve, which usually takes place during diabetes retinopathy or retinitis pigmentosa. Next category is intellectual impairment. In this category, the athletes who haven't gained their intellectual maturity or the adaptive behavior is hindering their social, conceptual and adaptive skills are categorized under this heading. But the main criteria over here is these athletes should be having intelligence impairment before the age of 18 years. Then only they are eligible to play in Paralympics under this category. So this was a complete gist of different sports classes, what are Paralympics, what are para-athletes, how can you become a para-athlete. Stay tuned for our next video, because in our next video we'll be talking about what are the common injuries these athletes going to face, and how training para-athletes from a strength and conditioning perspective is going to be different. Stay tuned and we'll meet in our next video. Till then, stay focused and dominate your sport.